everyone, welcome back to my channel Dental Elixir. So today we're going to explore the topic dental cements, starting off with their key properties. Over the next few slides, we'll be taking a closer look at each type of cements in more detail. So let's get started and see how they work. So basically there are some characteristic properties of dental cements that make each one of the cements better than the other. So starting off with film thickness and consistency, this basically determines the adaptability of the restoration to the tooth. How better can it adapt to the tooth? Okay, so the maximum allowable film thickness for luting consistency, luting application is 20 to 25 micrometer. For restorative application is 40 micrometer. Okay, so this value is important for your NEET, could be asked for your NEET exam. So for luting application, it is less, 20 to 25 micrometer. For restorative application is 40 micrometer, 40 μm. Now the film thickness basically depends on the 5 properties, that is particle size, powder liquid ratio, viscosity of the liquid, consistency of the cement, and amount of force. So here we have mentioned that the luting film thickness should be always less, that is 20 to 25 micrometer. Why is that so? Because lesser the film thickness, there will be greater flow. So because the flow is more, there will be more wetting of the tooth as well as the restorative surface, and thus improving the seating of the restoration. Now coming to the next point, which is viscosity, is nothing but the consistency of the cement. Viscosity is the consistency. So here the increase in viscosity depends on increase in temperature and time. When the temperature and the time taken to mix the cement varies, the consistency of the cement will also differ, which is nothing but the viscosity. Now next is setting time. Setting time is the elapsed time from the start of the mix to the point at which the mixture reached desired hardness or consistency. So from the time you start mixing the cement till it reaches the correct amount of hardness that is required for the restoration purpose is called as the setting time. Now there are two types, net setting time and working time, that you need to know under this. Okay, so what is net setting time? This is the time elapsed between the end of the mix and the time of setting. Okay, the time elapsed between the end of the mixing and the time of setting. Working time, on the other hand, is the elapsed time from the start of mixing to the point at which the consistency of the material is no longer suitable for its intended use. Next, coming to the strength. Okay, strength, it depends on the application. For example, under an amalgam filling, give a cement which can withstand the condensation force which is applied. Okay, so you have to use cements according to the need or the purpose of application. Okay, it is said that many dental cements as well as restorative materials continue to gain strength over a period of time. Okay, now this is very important for your NEET purpose, that is, the standard luting consistency of dental cement must exhibit a minimum 24-hour compressive strength of 70 MPa. Remember this, okay? Very important. Now coming to the next characteristic, that is modulus of elasticity. This is nothing but the stiffness of the cement, measure of stiffness of the cement. So it is said that cements that is given under the ceramic crowns should have sufficient stiffness in order to withstand the masticatory loads. Okay, higher the modulus of elasticity, stiffer the cement. Lower the modulus of elasticity, it is more flexible material. All right, coming to our next point, that is solubility and disintegration. So it is always said that solubility should be considered low, because if there is high solubility, then there will be marginal leakage leading to secondary caries. So solubility in water and oral fluids should always be low for dental cements. The lower it is, the better it is. Okay, and water-based cements are considered more soluble than resin or oil-based cements. Now, what are the factors that increases the solubility and disintegration rate, such as lower pH, that is more acidic environment, and decrease in powder liquid ratio? Okay, so here are certain values that you can see on the screen. ADA, maximum permissible rate for dissolution, for zinc polycarboxylate, how much is the weight percentage. So these are the values that you need to
know for your NEET exam. Okay, so they could ask for GIC, how much is it? How much is the weight percentage required? That is 0.1 weight percentage. For zinc phosphate, it is 0.2 weight percentage. Zinc polycarboxylate, it is 0.3 weight percentage. Okay, so this you should know by heart. Okay, so now coming to the next point, that is fluoride release. Many cements contains fluoride, which is gradually released over a period of time, in part adjacent teeth structure with caries resistance property. The most known example is glass ionomer cement, as you can see in the picture given beside, how it is placed initially and how the fluoride is getting released after a few months and get leached in the oral fluid and slowly it gets depleted, then again recharging by fluoride application, and then the cycle continues. Okay, fluoride is very important for caries resistance. Now coming to the next point, that is biological properties. So there are a few biological properties that we should know about the cements. When it comes to cements, you need to consider these points, such as pH of the cement, pulpal response, and pulp protection. Okay, so most of the cements, as we know, are acidic. There are a few exceptions to it, such as zinc oxide, eugenol, calcium hydroxide, and resin cements. So the acidity of the cements is higher at the time of placement, but gradually it decreases with time. Okay, now pulpal response may be classified as mild, moderate, or severe. Okay, originally silicate cement was used as surfactants. Because of its high acidity, silicates were classed as severely irritant cement. High acidity can irritate and sometimes it will lead to irreversible pulpal damage. Okay, before they used to use silicate cement, but later they realized that it was very highly acidic and it can cause irritation to pulpal region, leading to irreversible pulpal damage. In some patients, it can cause severe pain and sensitivity as well. The monomer present in the resin-based cement is also irritant. So you need to consider all these things when you are giving a restoration. Okay, whether does it cause pulpal irritation, does it cause irreversible pulpal damage or not. Okay. Now the third point is pulp protection. In case of deep cavities, this has to be considered, where the cement is classified as an irritant. Okay, when you realize that there is a cement that causes irritation to the pulpal region, you need to find measures to protect that pulp region provided following the restoration done above. So how can you protect the pulp? By avoiding thin mixes. Okay, and second is using a liner or a base underneath the restorative material. Now coming to the main point that I wanted to discuss, which is very important for your NEET preparation, that is RDT, remaining dentine thickness. So dentine is nothing but, as you all know, it is a mineralized hard tissue that forms the major bulk of the tooth. Okay, it is covered by enamel on the crown region and cementum in the root region. Okay, that is dentine. So what is remaining dentine thickness? Remaining dentine thickness is the amount of dentine that is left from the floor of the tooth preparation to the pulp chamber. Okay, so that you can see in the radiograph shown here. Okay, here you can see the remaining dentine thickness is 1.6 millimeter on the radiograph. Okay, that is the amount of dentine that is left from the floor of the tooth preparation to the pulp chamber. That distance, that amount of dentine is called as remaining dentine thickness. Okay, here it is 1.6 mm. So here you can see certain values, that is, if the remaining dentine thickness is less than 0.5 mm, it is considered very deep, very close to pulp chamber, and it is considered to cause irreversible pulpal damage. So you have to be very careful. So in such cases, if you are giving amalgam restoration, as we have discussed in the previous slide, you need to see how to protect the pulp in such cases. So here you need to give, if you are giving amalgam preparation, you need to give calcium hydroxide, RMGIC, that is resin modified glass ionomer cement, and a sealer or a dental adhesive as the base, followed by amalgam restoration should be given. In case of composite restoration, you need to give calcium hydroxide, resin modified glass ionomer, and dental adhesive. When you're doing indirect pulp capping, similarly you have to give calcium hydroxide, RMGAC, dental adhesive, or a sealer. Okay, this is in case of very deep preparation where RDT is less than 0.5 mm. If RDT is between 0.5 mm to 1.5 mm, then in case of amalgam preparation you need to give RMGSC and a sealer or a dental adhesive. You can avoid giving calcium hydroxide. Okay, in case of composite, RMGAC and a dental adhesive is enough. In case of indirect pulp capping, again RMGAC, a dental adhesive, or a sealer could be. If it is more than 1.5, greater than 1.5 to 2 mm is present, then in amalgam restoration, just a sealer or dental adhesive will do. In composite, dental adhesive is enough. And in case of indirect pulp capping, dental adhesive or a sealer is enough. Okay, so according to the amount of dentine present, you need to give the base layer, okay, in order to protect the pulp. Now, as we have discussed earlier, if the RDT is very less, that is less than 0.5 mm, then there is a risk of pulpal injury causing irreversible pulpal damage. Okay, so how to measure the RDT? It is measured using a device called as prepometer. Okay, so the value is displayed on the prepometer by a scale represented by 10 LEDs illuminated by using different colors. Okay, so green is always riskless preparation. Okay, green is always go. Then comes yellow, which shows further preparation is still possible. Then orange, where limited range of safe preparation can be done, and then it should be stopped. It is like an indication to be very careful. And then finally red, which shows imminent endangerment of pulp vitality. Okay, so that's a wrap for today's session. So let's do a quick summary. Quick summary in the sense, we're just going through the headings that we have learned. So what are the characteristic features that we have learned about dental cements? First was film thickness and consistency. We told that the film thickness for luting should be 20 to 25 micrometer, and for restorative it is 40 micrometer, and lesser the film thickness, better wetting and adaptability to the tooth structure would increase, and better seating would be seen. Then we discussed about viscosity. It is nothing but the consistency. Then net setting time was discussed. Okay, then strength of the cement was discussed. Modulus of elasticity was discussed. Solubility and disintegration was discussed. The low solubility is always better. Higher the solubility, it can lead to marginal leakage and followed by secondary caries. So we discussed certain values. You need to go through it for your neat preparation. Then we discussed about fluoride release. One example of a cement releasing fluoride was glass ionomer cement. Then biological properties, the three properties where you need to be very careful about the pulpal damage that can be caused, the pH, and how to protect the pulp. Then finally, very important topic was discussed, which is remaining dentine thickness. You need to know what it is, what are the measurements, and how to protect the pulp, and what was the device used to measure the remaining dentine thickness. So this was all about what we have discussed in this session, and I hope you have now understood a bit about the properties of these cements. So in our following next videos, we'll take a closer look at each type of dental cements one at a time for deeper understanding. So yes, that's it for today's video. Until next time.